بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وآله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. My topic today is about the anterior junctional line on chest X-ray and CT scan, and how it is important in diagnosis of the mediastinal masses, anterior mediastinal masses. The anterior junctional line is formed by the anterior apposition of the lungs and consists of 4 layers of pleura, separating the lungs behind the upper two-thirds of the sternum. The line runs obliquely from above right to lower left and does not extend above the mandibulo-sternal junction. It contains a variable amount of fat. Frequency of visualization of the anterior junctional line is about 25 to 55%. Here you see BA chest X-ray demonstrating the anterior junctional line run obliquely on the right side and going to the left side on the lower part. Here the magnified view for another patient, and we see the anterior junctional line run obliquely and going in its lower part and the left side, and it is seen at the level of the aortic knob. Here, this is the CT scan of a patient, axial cut and coronal cuts, patient with anterior junctional line, as we see it here, and it is seen here. As we said, that line has 4 layers of pleura, and incidentally, that patient has paraseptal emphysematous changes and another centrilobular emphysematous changes. Here, another patient with anterior junctional line. As we said, it is 4 layers of pleura. Abnormality involving the anterior junctional line. The anterior junctional line may be absent when its course is not tangential to the X-ray beam and can be obscured by other structures like heart, great vessels, and thoracic spine. Obliteration or abnormal convexity suggests of anterior mediastinal mass. Displacement of the line may be also seen by hyperinflation or volume loss of the surrounding lung. Here we see patient abnormal deviation of the anterior junctional line to the right side, as we see it here in the BA chest, and see here in the axial CT scan and the coronal MBR reconstruction CT scan. The patient has partial right lower lobe lobectomy, and we see here some changes in the right lung and in the ribs and the hypo and the small right lung comparing to the left lung, and the anterior junctional line is deviated to the right side by hyperinflation of the left lung. Here, the anterior junctional line is widely separated. As we said, minimal fat contained between the anterior junctional between the layers of the anterior junctional line. Here, more fat. It is in the between the anterior junctional line separating the anterior junctional line due to fat containing fat in between the layers of the anterior junctional line. Here we see the anterior junctional line are separated by dense enhancing mass due to thymic hyperplasia. In this patient, widening or loss of the anterior junctional line due to thymic mass and hyperplasia of the thymus gland. Here you will see the obliteration of the anterior junctional line in this patient with large anterior mediastinal mass due to lymphoma. And we see that the mass has soft tissue component and hypodense area due to cystic degeneration in this patient with lymphoma, and compressing of the blood vessels. Thank you very much for listening in this short talk about the anterior junctional line and its valuable for predicting and diagnosis of the anterior mediastinal masses.